Is it time to kill the low-fat diet as a treatment for cardiovascular disease? Well, new studies suggest that may be the case. I'm Dr. Brett Scher, the medical director at DietDoctor.com. And the study I want to talk about is called Long-Term Secondary Prevention of Cardiovascular Disease with a Mediterranean Diet and a Low-Fat Diet, CardioPrev, a randomized controlled trial which was published in The Lancet. Now, a low-fat diet has been sort of the most commonly promoted diet for decades for treatment and prevention of cardiovascular disease, but it's kind of surprising the lack of evidence to really support that as the best treatment choice compared to other diets. What they talk about in this study, in their introduction, they talk about how there's a primary prevention study, PREDIMED, for people who haven't had cardiovascular disease, which showed a small benefit to what they defined as the Mediterranean diet versus the low-fat diet. Although there were definitely some problems with that study in terms of the randomizations and so forth. But it did show a small benefit to the Mediterranean diet opposed to the low-fat diet. So they're saying now this is what they call the first in secondary prevention. So people who already have had heart attacks or coronary artery disease. So they had to have stable coronary disease. And they were enrolled in this trial. And they were randomized to a low-fat diet or Mediterranean diet. And they defined the Mediterranean diet as being high in fruit, vegetables, legumes, white meat, fish, and olive oil. And importantly, this trial took place in Spain. And for this intervention group, everybody was given a free liter of extra virgin olive oil every week. Or if you were in the low-fat group, you were given what they called a healthy food bag pack. They didn't say exactly what went in it, but it was a low-fat, what they call sort of healthy food, mostly, whole grains, avoiding refined grains and sugars and things like that. So, and importantly, they talk about how each group was an intensive dietary intervention. It wasn't just a dietary intervention and do your own thing. Both groups got intensive dietary management and counseling up with 12 visits per year between the physician and the coaches and the dietitians and whatnot. 12 visits per year, both of them. One being taught about low-fat diets. So their goal was less than 30% fat, 15% protein, 55% carbs. It looks like they ended up eating about 32% fat, 23% protein, and 45% carbs, versus the Mediterranean diet, which was their goal was 35% fat, 15% protein, and 50% carbs. And they ended up eating about 40% fat, 21% protein, and 39% carbs. Otherwise, the diets they tried to make them similar, but obviously the Mediterranean diet was higher in olive oil, nuts, fish, and eggs. And then the low-fat diet was higher in grains and potatoes and legumes. And it was a 7-year study, which is actually pretty remarkable for a randomized dietary study to go for 7 years. And they enrolled 1,000 patients. So that's a pretty big dietary study for a randomized study. The average age was 59, 82% were men. And this is important when we look at the results because they're kind of underpowered to detect for women. In the low-fat group, 17% dropped out. In the Mediterranean group, 9% dropped out. So again, it shows that the low-fat diets are just really hard for people to follow. They're not enjoyable for a lot of people to follow. They increase hunger for a lot of people. So they wanted it to be less than 30% fat, and people didn't comply. They were at 32% fat, and more people dropped out. So right away, the critics are going to say it wasn't a real low-fat diet. You got to get that fat down below 20%. So maybe that might be true to test a true low-carb diet, low-fat diet. But the question always comes down to, are people going to actually follow it, right? I mean, it doesn't matter how healthy it is if people can't follow it. And you can see here in this study, they had a harder time following the low-fat diet. It was a pretty sick population at baseline. Body mass index of 31, over 50% had metabolic syndrome or type 2 diabetes. Interesting, the average LDL was 88. So the LDL was, what many would consider very well controlled, but the triglycerides were 135 and the glucose was 114. So definitely a metabolically unhealthy population. And if you look at the medications they're on and the treatments, right, it was very LDL-focused treatment and not as much of a metabolic health-focused treatment that they were on. All right, but let's get to the outcomes. So the outcomes was a composite outcome. So in studies like this where if you're just looking at myocardial infarctions, it's going to be a small number. So you really need a ton of patients. So instead you do a composite outcome. So you need fewer patients for the same power. So it was a composite of heart attacks, revascularization, like needing stents or bypass, strokes, peripheral arterial disease, or cardiovascular death, all of those combined. And what they found was the outcome was 17% in the Mediterranean diet group and 22% in the low-fat diet group, which was statistically significant. A significant reduction in the Mediterranean diet compared to the low-fat diet. And interesting, if you look at the curves, they start to separate at 1 year a little bit, but where you really start to see them separate is at 3 years. And that's important because, when you look at 6-month studies maybe, or, if you're looking at outcomes, it just shows that you need a longer time to really track statistically significant outcomes. But surrogate markers, you can see change a lot faster. Now, they did say there was the most benefit was seen in men, but it was also had a stronger power for men because there were so many more men. So it could have just been underpowered for women, but there actually wasn't a significant benefit in women. Women are also lower risk, they have fewer events, so you're going to need a lot more women to show the same statistical power as you would in men. So that's one thing. Interesting, there was no difference in LDL between the two groups, despite the benefit to the Mediterranean diet. So does this prove that their version of the Mediterranean diet is the best diet? Well, no, because it only compared it directly to a low-fat diet. But what it does prove is kind of low-fat diet should not be the go-to option anymore. You need a diet that people can comply with, that people are going to enjoy and they're going to stick with, and that helps their health, both their metabolic health and their cardiovascular health, which are really one together. They're all combined. So in this version of this study, the low-fat diet was definitely inferior to a Mediterranean diet. Now, I'd like to see different versions of the Mediterranean diet compared to different interventions, especially ones that target metabolic health, because I think it's clear that these patients were not being well treated for metabolic health, and that's something that we need to focus more on. But anyway, time to retire low-fat diets. I think that's pretty clear that for the majority of the people, they don't work and most people aren't going to stick with them. Now maybe, there's always going to be some subsets of people, right? There are going to be subsets of people who can follow a raw vegan, low-fat diet and feel good and enjoy it. I think it's pretty clear that's not the majority of the population. But if someone's in that population, then by all means, if it's improving your health, your metabolic health, your cardiovascular risk, and you're feeling good and have good energy and still maintaining your muscle mass, then by all means, those are the important points to hit more than one specific diet. But anyway, that was my take on this. I hope it was helpful. If it was, please click the thumbs up and subscribe, and we'll see you here next time on Diet Doctor News on YouTube.